This week, we are going to learn about environmental health, policy and regulations, and the role of public health nursing in both. When we say the word environment, the first thing that probably comes to your mind are physical locations in which you actually spend a lot of your daily life, such as your home, neighborhood, parks, and open green spaces. When you consider the health of the environment, you actually have to pay attention to both the seen, such as the water and the land, and the unseen, the microscopic pollutions, or even the air, as well as social factors, including individual and societal behaviors that shape the world. A holistic definition of environmental health would include physical, chemical, biological, social, and behavioral factors that influence the environment. A thorough understanding of environmental health requires looking beyond the factors that compose environment and determining whether it is healthy or unhealthy. You need to also carefully consider the interactive effects, and you need to further analyze the role of human behavior and response to the environment that is consequently shaping the world and impacting everybody's health. The environment is intimately connected with human health, illness, and mortality. All human beings are affected in some way by exposure to environmental hazards associated with lifestyle. This could be at work, at home, during recreation, or traveling on the expressway. Some examples of this are the fact that the World Health Organization has estimated that in 2012, approximately 12.6 million deaths across the globe, 23% of all the deaths, were linked to environmental sources. The US EPA reported that in 2015, industry released 881 million pounds of toxic chemicals into the air and water. Elevated blood levels of lead continue to be an important problem in the United States, with children living in at least 4 million households that expose them to excessive amounts of lead. These are just some examples in which humans are affected by their environment. The elderly, persons with disabilities and chronic diseases, pregnant women, and children are more likely to be affected by environmental hazards than are the members of the general population. With respect to age, research from the WHO underscored the differential effects of environmental influences across the life course. Age groups most likely to be impacted are children younger than 5, children as old as 10 years to a lesser degree, the older adults from 50 to 75 years. Children represent an especially vulnerable group with respect to exposure to hazardous materials, including pesticides and toxic chemicals. Their immune systems and detoxifying organs are still developing and not fully capable of responding to environmental toxins like adults are. Children may be exposed more often than adults to toxic chemicals in the ambient outdoor air and in the soil because they spend more time outside and in the soil. Residents of developing countries suffer far more from problems associated with environmental degradation than those that live in developed countries. This observation holds true despite the fact that developed countries are highly industrialized and disseminate vast quantities of pollutants into the environment from industrial processes and motor vehicles. In comparison with developing countries, wealthy nations provide better access to medical care and are better able to finance pollution controls. In the developing world, the pursuit of natural resources has caused widespread deforestation in tropical rainforests and destruction of wildlife habitat. Although these two issues have been the focus of much publicity, less widely publicized environmental hazards such as water contamination, air pollution, unsanitary food, and crowding take a steep toll in both morbidity and mortality in developing countries. The term environmental risk transition has been used to characterize changes in environmental risks that happen as a consequence of economic development in less developed regions of the world. Environmental risk transition is characterized by the following circumstance. In the poorest societies, household risks caused by poor food, air, and water quality tend to dominate. The major risks existing in developing countries today are of the type diarrhea, which is attributable to poor water, sanitation, and hygiene, acute respiratory diseases due to poor housing and indoor air pollution from poor quality household views, and malaria, poor housing quality, although all are, of course, by other factors as well, such as malnutrition. These problems are in a number of the countries in the developing world. Currently, the human population is increasing at a geometric rate, which is overwhelming available food resources, leading to some areas of the world right now to face periodic food scarcity and famine. A number of factors have contributed to population growth, including increases in fertility and reductions in mortality. One of the consequences of population growth has been to encourage the conversion of large rural and forested areas of the earth into cities. Urbanization is linked to numerous adverse implications for the health of populations, including increasing rates of morbidity and mortality. Rapid growth of the world's population contributes to the deterioration of the environment through widespread depletion of natural resources and by causing the levels of air, water, and other forms of pollution to increase. Also, the resources available per person decrease as the total number of individuals on the planet continues to increase geometrically. Consequently, population growth is a determinant of the number of persons who live in poverty. In already crowded regions, an even larger population means that the size of most people's living spaces must decline and population density must increase. Population density and associated urban crowding are dimensions of environmental degradation associated with increases in the spread of infectious and communicable diseases. Unless significant technological innovations can be introduced, merely feeding the world's hungry population will become problematic. Many developing countries, where population growth rates are among the highest in the world, such as India, are reaching the limit of their abilities to provide for the economic and social needs of their citizens. The effects of rapid growth of the world's population include urbanization, overtaxing carrying capacity, food insecurity, and the loss of biodiversity. Carrying capacity is the maximum number of individuals that can be supported sustainably by a given environment. Both human and non-human populations may be threatened with disastrous consequences when available resources are exhausted. This can include animal populations. A good example of this was when the U.S. Coast Guard shipped 29 reindeer to St. Matthew Island in the Bering Sea during the World War II era. The deer were intended as a source of meat for personnel on the island. However, no deer were ever culled, and all 29 remained when the war ended. An abundance of deer fodder was available on the island. By the early 1960s, the original deer population had actually swelled to 6,000 animals. Soon afterward, as a result of overgrazing and depletion of food sources for the deer, the population, having declined to fewer than 50 animals in 1966, actually faced extinction. Endangerment of the human population through ecological damage is not far-fetched. Previous history has recorded incidents of decimation and the collapse of civilizations that were associated with disruption of the environment. It is believed that approximately 5,000 years ago in Mesopotamia, a renowned ancient civilization declined as a result of agricultural practices that caused soil erosion, buildup of salt in the soil, and the filling of irrigation channels with silt. The term food insecurity refers to a situation in which supplies of wholesome foods are uncertain or may have limited availability. Food insecurity and famine may occur when the carrying capacity in a particular geographic area is exceeded. An example of the effect of exceeding the carrying capacity in a local geographic area is the occurrence of local subsistence crisis, which follows the ability of the land and the availability of water to produce food that are overtaxed. The word biodiversity is formed from the combination of biological and diversity. An adequate definition of biodiversity is not actually available. Nevertheless, the term biodiversity generally refers to the different types and variability of animal and plant species and ecosystems in which we live. With respect to a particular geographic area, biodiversity involves diversity in the genes and the population of a given species, diversity in the number of species, and diversity of habitats. Biodiversity is considered to be an essential dimension of human health. The dramatic human population growth during the past few decades and the increases in urbanization and industrialization have caused the physical environment to be degraded substantially. One of the consequences of unchecked population growth is hypothesized to have accelerated the loss of biodiversity. Human activities are thought to be related to the spread of harmful insect vectors, extinctions of species, the loss of flora. Some of the plants and trees could be the source of valuable commodities such as new pharmaceuticals. Ultimately, loss of biodiversity may pose a danger to food production as a result of the growth in numbers of invasive species and the eradication of helpful plants and insects. Negative human impacts on the environment are thought to have begun many thousands of years ago. One of the initial targets of human activity was forests, which were cut down for use as timber and burned to clear land for agriculture and human settlements. Deforestation subsequently led to soil erosion that caused rivers and bays to be foiled with silt. Hippocrates, who lived in 460 to 370 BCE, often is referred to the father of modern medicine. He actually emphasized that the role of the environment is an influence on people's health and the health status in his work titled On Airs, Waters, and Places. For many years, people have known about the harmful effect of heavy metals. Hippocrates identified the toxic properties of lead. The toxic properties of sulfur and zinc were pointed out by the Roman scholar Pliny the Elder during the 1st century, when he invented a mask constructed from the bladder of an animal for protection against dust and metal fumes. During the 2nd century, Galen outlined the pathological aspects of lead toxicity and suggested that mists from acid could endanger the health of copper miners. Beginning in 500 BC, as Rome grew, a system of aqueducts that supplied fresh water and a web of sewers was installed. In 1906, Upton Sinclair described the deplorable conditions in the meat processing industry in Chicago. Sinclair's expose was instrumental in the passage of the first Food and Drug Act that was instituted in the United States in 1906. One other development that reflected the public's concern for the environment was the creation of the U.S. National Park System in 1916. There has been air pollution episodes that have been marked. One was in Pennsylvania in 1948, but the most infamous one was in 1952, which was the deadly fog of London, which actually had several casualties associated with it. In 1970, the Environmental Protection Agency was founded in the United States to address environmental concerns at a federal level. The topic of toxic waste disposal was much of the focus and the attention of the 1970s. You'll find in future presentations that a lot of the health the Environmental Health Acts were actually in the 1970s and 1980s following the formation of the EPA. The role of the public health nurse in environmental health actually depends on the organization that the nurse works in. It also actually depends on existing laws and regulations. Some agencies, include an environmental health section, and some employ a single environmental health specialist or sanitarian. Agencies provide services for building code compliance, solid waste disposal, and hazardous waste removal. If there is a sanitarian on staff, the public health nurse may serve as a consultant to the sanitarian or work with those cases that need long-term follow-up due to medical or health impacts. The agencies where there is no sanitarian, public health nurses may do the environmental risk assessments themselves. Public health nurses actually, and quite frequently, collaborate with human service providers working in child protection or with vulnerable adult populations. The public health nurse may accompany a social worker to a home to assess safety conditions, or might request a social worker to intervene after doing an initial home visit. Existing laws and ordinances greatly shape the role of public health nurses in addressing environmental hazards or risks. For example, a state law or local ordinance may designate a public health inspection. If that's the case, the public health nurse may accompany or track progress. Some states locally designate local public health to be the final authority on cleanup of homes. Often public health nurses need to be fluent on issues related to lease agreements, tenant rights, and accessing low-cost legal assistance as they provide counsel to vulnerable clients. Nurses also need to advocate with medical providers and insurance companies to provide equipment that reduces the risks of those with chronic diseases who are exposed to environmental health hazards in the home. An example of this is a home health care nurse who has clients with respiratory conditions. They may need to advocate for air purifiers to improve the quality of the indoor air.